What do you think of when you hear the words hospice care? It can be devastating words to hear if you are a mother who has been told you have less than 6 months to live, if you are a son who does not want your loved one to move on without you, if you are a father who just wants more time. The hospice program is not meant to bring devastation, but to provide help and comfort to patients and families by focusing on quality of life, integrating holistic treatments. Hospice care is a provision through Medicare. It's a service to dying patients and the terminally ill to help with the transition to the final stage in life. The primary focus of hospice is not cure of disease, but rather quality of life. An interdisciplinary team works with the patient and their family, providing comprehensive care that includes palliative care, counseling, spiritual guidance, and respite care. Although hospice care is essential to our vulnerable population and their families, fraud and abuse of the program drives up costs and quality care is neglected. Implementing programs to identify these issues and to help prevent them from occurring is vital for the continuation and effectiveness of the hospice program. In 1967, St. Christopher Hospice was the very first hospice and was founded by Dame Cicely Saunders. St. Christopher Hospice was groundbreaking, being the first research and teaching hospice linking expert pain and symptom control, compassionate care, teaching, and clinical research. It wasn't until 1974 when the first hospice in the United States was founded in Branford, Connecticut. 8 years after Connecticut Hospice was founded, the U.S. Congress included a provision to create a Medicare hospice benefit in the Tax Equity and Fiscal Responsibility Act in 1982. In 1986, the Medicare hospice benefit was made permanent. There are certain criteria that must be met for a patient to qualify for hospice. They must be certified by their primary physician or hospice doctor that they have less than 6 months to live. They must accept palliative care, not care to cure, and they must provide a signed statement that they are choosing hospice care. Hospice is such an important program for our most vulnerable population. It is important that it is not abused. Unfortunately, it is. The Office of Inspector General has identified several weaknesses in the program in which improper care, incorrect billing, and fraudulent cases have been identified. As utilization of the hospice program continues to grow, we must strive to ensure Medicare beneficiaries are not taken advantage of and that they receive the best possible care at the end of life.
Effective delivery of care requires a skilled workforce and beneficial services. The American Academy of Hospice and Palliative Medicine created a plan to support quick growth in training volume. Despite these increases in training volume, they have been unable to keep pace with population growth and the demand for high-quality hospice services. As a result, innovative providers are searching for new services that add to the well-being, comfort, and peace of mind of patients and their families. Technology is at the forefront of these efforts. Developed by Capital Caring, a large nonprofit community hospital in Washington, D.C., telecaring focuses on outbound phone-based care services and proactively attempts to identify problems that patients and/or their caregivers may be experiencing. This graphic represents utilization of clinical services comparing telecaring participants and non-participants. As you can clearly see, those who are participating in telecaring are utilizing less clinical services. Hospice care and the long tail theory. Popularized by Chris Anderson in 2004, it is based on a view that as retailers make use of the internet to offer more products at cheaper prices, they won't have to count on the big hits to support their sales. In other words, the demand curve moves away from the head and flattens towards the long tail. In contrast, healthcare has a long tail problem referred to as barriers to access. This causes distribution inefficiencies relating to getting services to individuals most in need. However, new technologies like telecaring permit the effective delivery of hospice care services regardless of location.
Hello, My name is Abigail Jones, and I would like to go over hospice care and financial management. End-of-life care costs are covered by various government agencies, including Medicare, Medicaid, healthcare programs sponsored by the VA and the Department of Defense, and private medical and long-term care insurances. This chart shows how hospice costs are paid for. The vast majority of hospice costs are being covered by Medicare at 85%. While the other 15% is covered by other entities like private insurance, Medicaid, or even self-pay. Like previously stated, hospice is overwhelmingly funded by Medicare. In 2016, Medicare even paid hospice providers approximately $17 billion for the care provided. Per patient, this is about $11,820. Large payments like these have allowed care organizations to flourish financially. Therefore, those contemplating starting a hospice program could have great success. Those who are thinking of starting a program should consider implementing a precise internal cost accounting system. This system could provide the managers of the program with information to prepare grant proposals, budget projections, and develop other reports to assist in making more educated and prepared business decisions. Breaking into this field is not easy though. Hospice care typically has higher costs due to everything these programs include. They include all that are shown here. Only about 30% of hospice costs go to nursing, and the other high amounts are going to pharmacy and inpatient care. The rest is broken into admission costs, mileage, home health aides, social workers, pastoral counseling, DME, and other costs. Ultimately, smart business plans and compassionate care can lead to a great hospice program that is not only lucrative, but is providing great care to patients and families. Thank you.
What is Healthcare Fraud and Abuse, and How Does It Affect Honest Providers? By Lynn Williams. Hospice provides comfort for families, caregivers, and beneficiaries. Beneficiaries forego curative care for the terminal illness and choose to receive palliative care instead. The care can be provided in a number of different settings, including the home, nursing facility, hospital, and hospice inpatient unit. Hospice care has grown steadily the last decade. As you see from the slide, it has grown from 9.2 billion Medicare dollars in 2006 to 16.7 billion spent in 2016. With the steady increase in hospice care, cases of healthcare fraud and abuse have also increased. Healthcare fraud is knowingly submitting false claims or making misrepresentation of fact to obtain a federal health care payment. Examples of fraud include billing for appointments the patient did not attend, billing at a higher level of services than needed, billing for services or supplies not provided, and paying for referrals. Healthcare abuse is the unnecessary cost to Medicare program, including not providing patients with the necessary medical services that meet professional standards. This would include billing for unnecessary medical services, excessive charges for services or supplies, and upcoding or unbundling codes on a claim. OIG identified vulnerabilities with hospice. Through evaluation and audits, concerns were raised about billing, federal oversight, and quality of care. They found cases of patients being enrolled without beneficiaries' knowledge, billing for services that were not done, enrolling patients that were not terminally ill, paying kickbacks, and documentation that was falsified. Inappropriate billing by hospice have caused Medicare millions of dollars in inappropriate payments. The OIG report found in 2012 that one-third of inpatient stays were billed incorrectly. Inpatient stays are the second highest level of care and cost Medicare $268 million. For providers, healthcare fraud and abuse cause closer scrutiny of care and potentially decreases reimbursement to reputable providers. It shapes policy, potentially decreasing access to care and eligibility. Payers will then limit the benefits and level of care that are covered. Co-payments and deductibles for patients will increase, driving up out-of-pocket expenses. Fraud and abuse triggers rising healthcare costs, and employers are unable to absorb the benefit costs, thereby passing the costs on to the employees and bringing down wages. Physicians with smaller practices may leave their practice due to being too costly to operate.
Hi, my name is Rana Ershid and I'm presenting about Medicare fraud. The hospice program spends about $600 billion in a year on certain healthcare programs for tens of millions of seniors, along with the fraud and the inappropriate billing has reached up all time for around $60 billion in a year. This amount found out to be twice of the amount of the beneficiaries that are receiving care from hospice care has increased by 53%, and this percentage has been increased from 2006 to 2016. The numbers of beneficiaries that have received hospice care in 2016 is 1.4. These numbers have been documented by Department of Health and Human Services. Approximately 25,000 beneficiaries of Medicare analysts pursue fraud cases by using fake aliases and fake case numbers that are stolen. The Medicare numbers do not change once the numbers have been compromised. Then it might be possible that Medicare benefits and other services for that person might be at risk. Consequently, if the beneficiary services the health care after the fraud, it can affect the quality of the care. Simply might be the beneficiary services health care that is out of low quality, and that might leave the impact of the health services. In the future, the beneficiary might receive treatment from the provider who is legitimate, but because of the falsified medical history, the consequences can lead to records of showing treatment that might not have ever occurred, the lab results might be incorrect, and the diagnosis is false. The errors and the abuse can all lead to a high numbers of out-of-pocket costs that the beneficiary has to pay. Those costs paid for services that were never provided for patients or those which were medically not necessary. In addition, the beneficiary might be stuck in a situation that is related to billing services. Instead of billing Medicare and other care services, they end up billing the beneficiary for the whole cost. Medicare numbers are as valuable as the Social Security number because when compromised, it can cause financial and security issues to the benefactor. Therefore, the beneficiaries have to suffer in cases of frauds. They do not receive the proper Medicare health services and might change when the extra services that they have not to have. This can
Healthcare fraud and how it affects taxpayers, specifically hospice care fraud. Some very bad characters in the healthcare system rip it off at an annual estimate of over $60 billion a year. This is money that does not go into patient care, nor is it going to the salaries of the staff who take care of patients. It's going in the pockets of bank accounts of people who are criminals. What's truly sad is that so many of them are professional degrees. Some are even registered nurses and doctors. What concerns us here is the cost of hospice fraud in particular, that affecting Medicare, the government health care program, which covers mainly retirees age 65 and over. When it comes to fraud, it is the taxpayers who end up footing the bill until the bad ones get caught. Here's an example from North Texas. A former manager of a hospice, who also happened to be a registered nurse, was found guilty of the charge of healthcare fraud. She admitted to playing a role in a scheme that cost the taxpayers $60 million. Jessica Love, who is the regional director for the company, Novus, and was also a case manager, is now looking at $250,000 in fines and up to 10 years in prison. She may get a break though. She's turning state's evidence against 13 other people, including her boss, the owner, Bradley Harris.
company that provides comfort to dying patients is accused of using those patients to take millions of dollars from the government.
The community watchdog Nate Morabito found out the U.S. government filed a whistleblower lawsuit against Caris Healthcare on behalf of a former hospice nurse.
Specific to Bristol, Virginia, in court documents, the former nurse said the company made it clear she needed to secure patients whether they qualified for hospice or not. And once they were in the system, she and her coworkers needed to keep them there, even if they were not dying. The lawsuit argues up to half of all of Caris Healthcare's Medicare claims were false or fraudulent.
But Houston Hospice is the focus of two FBI raids today, one in Houston, the other in Beaumont. Our Brett Buffington was there as agents started removing evidence from the hospice on the south side.
It was quite the packing process. Several dozen boxes moved out of this Harbor Hospice office building and packed into this truck, many marked as medical records. The FBI only telling 11 News Today this is part of an ongoing investigation.
Here's some relevant numbers. Medicare beneficiaries who were recipients of hospice care increased in number around 53% between 2006 and 2016. Around over $16 billion was spent on hospice care that year. Number two, in the United States there was an increased number of hospices of 43%. Between a decade spanning 2006 to 2016. There's also been, during that period, a rise in Medicare fraud. With inaccurate billing and outright fraud, the cost to Medicare, the taxpayers, has been about $60 billion. And hospice fraud is a big part of that number. Inappropriate billing, using techniques such as upcoding, charging for more expensive services than was actually given, plagues the hospice system. United States government agencies that are responsible for bringing legal action against those hospices found to be involved with suspected or actual fraud are the United States Department of Justice. The FBI usually does that. The U.S. Department of Health and Human Services, Centers for Medicare and Medicaid, Anti-Fraud Section, and the United States District Attorneys for the regions they cover. Interestingly enough, much of the fraud uncovered, while not limited to this region, seems to occur in the South, particularly in Florida, possibly due to a large number of retirees who are residents there. To defraud and take advantage by inappropriate billing of patients in their final days, which are often filled with severe pain and illness, is inexcusable. The cost to Medicare, and by that route the taxpayers, hurts it more than financial damages. It wrecks people's faith in the system. It erodes and destroys trust. But when good citizens report suspected cases of fraud, hospice care especially, the action of the U.S. government to bring the perpetrators to justice can restore that faith and trust. Thank you.
Hello, welcome to the future of hospice care. As our population continues to age, the current landscape of healthcare and the delivery of related services will shift significantly, especially in hospice. A peek into the future of hospice care sees new innovations, increased transparency, advocacy, and quality improvements as the key elements for strengthening existing compliance processes, improving oversight, and doing more to keep beneficiaries and caregivers informed. As mentioned previously, innovations like telecaring are playing a vital role in ensuring that those in need of end-of-life care services receive them regardless of their location. The Centers for Medicare and Medicaid Services has a new informational website called Hospice Compare. Because the quality of patient care that hospices provide to patients and families can vary from hospice to hospice, it is important that consumers have access to information about hospice services and facilities in their area. In the spirit of advocacy, hospice care organizations and leaders must continue to take an active role in politics, engaging with local, state, and national lawmakers in an effort to address regulatory and legislative issues related to hospice care. Quality improvements in hospice care must also include one of the most important components of hospice care, family. Focusing on family members and their interactions with their terminally ill loved ones is important, as they are often the primary caregivers, playing a key role in the decision-making processes. Eventually, hospice touches us all, For those of us working in this field of healthcare, it is natural for us to become involved in someone's death as well as life. Therefore, it is necessary for everyone to go over and beyond our areas of knowledge and compassion so that we can provide end-of-life care not only as professionals, but also as human beings.